If we're going to talk about measuring the patient experience, it's really important we start with the consumer voice. And so I'd actually like to invite Lorraine Powell to provide the opening comments. And I'll just remind Lorraine to put it nice and close to her mouth.
Agonising headache. Stiff neck. Advised though I had the best possible doctor for the lumbar puncture. Frightened. Then screaming and crying in pain. The nurse, in such a reassuring tone, patted me on the hand and said, "Don't be silly, dear. The book says it doesn't hurt, so it doesn't hurt." I was quickly admitted into a bed by the window in a lovely, brightly lit shared ward. Laying under the covers to avoid the light, this friendly voice came through and said, "Come on, honey, it's a beautiful day outside. Come out and enjoy the sunshine." Distressed, crying. I told her the light was making my headache worse and I couldn't do this anymore. New bed arrangements were made for me that day and immediately. That amazing voice was the cleaner. Relieved. Episodes of care are viewed through different lenses, dependent upon an individual's position, preferences, roles and responsibilities. Each individual also has their own perspective on both the experience of care and their personal satisfaction with the experience of care. And so what's the difference? Is our care being given with care? What is the importance of measuring the patient's experience or the person's experience? I don't want or intend to get sick, certainly didn't that day. I want to be healthy. But there are times when we all rely upon our healthcare system to treat our wounds, our illnesses and our diseases. That is care. Satisfaction is the fulfilment of my need, and it's values-based. The real experience of care is subjective, emotional, and personal. It's my opinion of what matters to me. It means understanding my expectations, my concerns, needs, culture, language, feelings, and preferences. It's not just about how well a procedure was done, or if it adhered to the national standards or a clinical framework. Satisfaction is a net effect. The total physical and emotional impact of the care I experienced. If the care was suitable and safe, improved my quality of life, returned my health, and includes how I felt before, during, and after that experience. Any answer you get depends very much upon the question that you ask. In order for a questionnaire to be useful, the data it produces must be trustworthy and reflects the truth. Thousands of research dollars have gone into developing survey tools to ensure that they are validated, to make sure whatever it is functions as it's expected and produces reliable and true data. We've got many tools and surveys and questionnaires to measure health performance, activities and outcomes that can provide trends, beautiful report cards, all classified into metrics that are considered important to a service or a healthcare provider, and produce data that is reliable and true, it's objective and it's quantifiable. So a few years ago I was involved in a research project that was being done to validate a consumer measure outcome tool and quality of care. The messages I received from the participants as I was facilitating the groups was very clear, that the tool wasn't measuring what they considered were important to their outcomes or their quality of care. And so that was fed back quite strongly in my reporting. those people were felt very non-validated when the feedback from the researcher said none of what we had said was going to be included because that wasn't what they wanted to measure. We cannot abandon what is meaningful for what can be measured, unless surveys can accurately capture what the person wants you to know, rather than what is easy to be quantified. In other words, person-driven. Then services will continue to capture data that reflects their requirements or expectations of what they want to know. Analysts use classifications and aggregated data that reflects their requirements and provide their reports. And anything outside those boundaries generally fails to be recognised as important. Those outliers actually are often reflecting what a person considers to be important. That's the subjective opinions and judgments reflecting a person's values and that's meaningful to them. People are already measuring their experiences with and without surveys, and those methods don't require validated tools to do so. Social media has become the TripAdvisor of healthcare. Twitter, Facebook, etc., blogs. We've got websites like White Coat and Patient Opinion. People who don't feel heard and have a passionate response towards their healthcare can and do create their own method of saying what they want to. So if I was to tweet, right patient, right time, right procedure, competent doctor, belittling nurse, cleaner, the best experience of all, at bleep hospital, never going there again, #vocal patient. I have a dream that healthcare embraces technology and listens to the stories we tell, where every person is actively encouraged during their care to provide ongoing feedback in a way, a language, or a style that suits them when they want to do it. So, without ethics approval at all, and using a tool that's not validated, I'm going to do a little survey, as you do. We've handed out how many for feedback forms? 8, 7 so far?
I think this will be the 7th one.
This will be the 7th one. Please don't fill this one out. Okay. Can I have a show of hands in the room? How many of you have filled out every single feedback survey that you've been asked to fill in after each session? Be honest. Okay. We're not going to dig that. I don't need to know that information, so it's not important. Okay. How many of you have had a conversation at your table or over coffee or in the toilets or wherever else you've happened to mingled over the last couple of days or after the last few sessions about what your experiences were in these sessions? Let's have a look. Guess what? Non-validated tool, non-ethics approved. I just had a 100% return rate. So why, given in the room I saw about 4 hands that have done 100% of the survey responses, why is that? I would propose 2 ideas. We don't really know why it's being done. Is it funding? Is it ego? You beauty, we did a great job. Can we produce a report? Or is there some other intent or meaning? And 2, what's actually in it for me to complete a survey form? What am I getting from it? Of the thousands of people experiencing care, unless you can achieve a return rate of at least 50%, then I would suggest that you are not getting a very good understanding of the individual's experience. Any activity has a number of associated risks, and surveys can be an accountability tool. They can also be perceived as a hierarchical quality improvement project that produces staff acting the survey, rather than feeling valued, empowered, and satisfied with their experience, which would lead to better health outcomes and reduced sentinel events or near misses. They can produce or encourage staff and patients to create a culture of openness, transparency, of being comfortable with the process. Or they can produce a smokes and mirrors approach to healthcare by tricking the people that they work with, the patients, into believing that they had better care. Do they actively improve working conditions to enable staff to provide the care that they genuinely desire to give, or are they a distractor or enabler of the business? Evidence supports that by providing high quality, satisfying, person-centred healthcare leads to better outcomes, reduced length of stay, less harm, reduced costs and more satisfied staff. Provision of surveys to measure this is the challenge, and having a culture of transparency and our care including manners and compassion, care being given with care. People may forget what you said. People may forget what you did. People will never, ever forget how you made them feel. My experience, my story that I shared today, occurred over 30 years ago. I felt it then, and I still feel it today. It is my story, and I choose to tell it. And we all have our own story. The story is the experience, and is not a set of data to produce a report card with. So I'm looking forward to the discussion this afternoon, and I'm going to finish with a question for everybody to ponder and for the panel to have a think about. Are you asking what you want to hear, or are you letting me tell you what I want you to know?